Assalamualaikum and hi everyone. My name is Hashia binti Ahmad Wafa and my supervisor is Dr. Raiha binti Aminuddin. Today I will be presenting my final year project titled Data Visualization of COVID-19 Pandemic using a density-based clustering algorithm as a requirement to complete my bachelor's degree in computer science. So, as we have been living in this pandemic for almost 2 years, we can see that there are various measures that have been taken by the government, such as banning interstate travel. However, banning interstate travel only minimizes the spread of the virus, but we are not only fighting against the virus, but we are also fighting against fake news. And as a computer science student, there are many things that we can do to combat that issue. First and foremost, fake news is news that have been manipulated or are conflicting, and it is a threat to public health because it can create unnecessary stress and also unnecessary panic. And what we aim to do is to combat fake news by visualizing all of the credible data at one place. Here are the problem statements that we have gathered. The first one is there are much room for inconsistency and misinformation. And from a computer science student's point of view, I can see that it's not that hard to separate credible sources from those that are not credible, but we have to consider that not everyone is as IT savvy as us, and when we want to do a project or when we want to start something, we should start them not based on what we want, but it should be based on what the users want. Okay, so the second problem statement is the existing dashboard in MyStructure only displays images and it's not interactive. If you have your phone with you, you can go to MyStructure and you can look at the statistics tab. As you can see, there are various visualization of data, but the data only goes back to 1 week ago. And there are no function yet in the application to go to a certain date or a certain place to look at the data on that date and at that place only. And the last problem statement is privacy concerns regarding installation of application. Actually, in Singapore, some people do not want to have a tracking device on their phones, and what the Singaporean government did was introduce tag. It looks similar to the AirTag by Apple, and what it does is it's basically a contact tracing device. It's a tracking device actually, and when they have the tag, they do not have to install anything on their phones. And this is especially important to people such as those that are working with the government or those with, a very high security and those who value their privacy very much. So by making a web application, they do not have to install anything on their phones. The solution that we have proposed is to develop an interactive web application that can visualize the current COVID-19 situation using density-based clustering algorithm so that users do not have to refer to a bunch of different applications. So there are various features in the system, but there are 7 major ones. The first one is it's interactive and responsive. It can be filtered based on the location or the date. And the second one is there is a choropleth map for each continent. The third one is we have a GDP per capita versus life expectancy scatter plot for each continent also. And the fourth one is there's a line graph showing number of cases and also the number of deaths so that you can detect the trend. And the fifth one is there's a graph showing the total number of people who are fully vaccinated. The sixth one is there's a live Twitter feed. It is specially curated to show the latest news on COVID-19, and the last one is there's a summary of the current COVID-19 situation. Once you enter the web application, this is what you will see first. By default, it will show the visualization from Malaysia on the 4th of July 2021. The reason why I had to set a maximum date is because I'm not using live data. However, I did try to use data straight from GitHub. It is live, it is updated daily, but I do realize that it takes a significant amount of time and I chose not to do it because it will affect the user experience. The reason why it takes more time than just the approach that I did is because every time you execute the web application, it has to go through pre-processing again and again. However, you still can select all of these dates here. On the far left, you can see the summary for Malaysia. Firstly, it states what continent it is in, and then the date that we chose, the number of new cases, number of new deaths, and total death, total fully vaccinated, and other countries in the same cluster as Malaysia. As you can see, these are all of the countries that has been clustered into one cluster with Malaysia. And the way I got it is by using DBSCAN algorithm, and DBSCAN uses the number of new cases and also the number of deaths, and by the number of cases and also the number of deaths, they can cluster countries together. So for example, these two components are based on the continent of the country that you chose. Okay, and these two components are based on the country that you chose. So for example, if you change the country to United Kingdoms, for example, it will change this core path map. Instead of the Asia continent, it will show the Europe continent. Same goes to this. It will show the countries that are in the Europe continent instead of the ones in Asia, such as just now. If you change the date, change it to 2nd of July, it will change here and also here. Okay, so as you can see, the countries in the same cluster as United Kingdom is not the same as the countries that were in the same cluster as Malaysia. So we are going to explain the components one by one. Firstly, this is the Europe continent, and as you can see, all of its countries are here. There are between 0 to 100,000, and you can hover your mouse and you can see for each country the number of cases. But for the ones that you chose, it will be stated here. And here for the next one, you can also hover your mouse and you can see the location, GDP per capita, life expectancy, and also the population. And the size of each of the bubbles is actually based on the population. As you can see, Russia has a very big population compared to Serbia. Okay, next we have timeline of cases in United Kingdom. The blue one is for the number of new cases, while the red one is for the new deaths. But you can't really see the trend for the new deaths. So to look at only the new cases, click once on new death, and you can see the new death only. You can also use this one. There are many functions that you can use, and then if you want to look at it again, just use this. If you want to compare the two, click on this one, so it will compare the data each time you hover. But if you only want to see one, just click on that one. And if you only want to see new death, double click on new death. However, it is not as easy as it sounds. You have to double click it very quickly, which I did it, but I fail most of the times. And that is one of the weaknesses of Dash application actually. But as you can see, this is the trend for the new deaths. You can hover your mouse, look at it for each day, double click it again. See, it's really hard. Double click it again. Okay, now you can see the new cases only. Next, we have total people fully vaccinated in United Kingdom. You can't really see the data here, so use the tools given to look at the data one by one. Okay, if you want to save any of these components, any of the graphs that have been plotted, just click on the camera button. You can save each one. Just download them, and it will be saved as a PNG file. See, it's a picture. Okay. Last but definitely not least is the COVID-19 live Twitter timeline. This timeline refreshes by itself every time there's a new tweet, and it is specially created only with official Twitter accounts, so that it will not include tweets from people who spread fake news. Okay. As a conclusion, after we have completed this system, you can see that all of the objectives of the system was achieved, and after running some usability testing on 30 respondents, most of the respondents highly agreed that the dashboard is interactive, provides relevant data, easy to navigate, and has easily interpretable data or visualization. And hopefully, this research will benefit not only policymakers but also the general public. So that is all from me. Thank you so much for your time. If you have any questions, please contact me either through email, hashirawafa@gmail.com, and you can also text, call, WhatsApp, or reach me through Telegram through my phone number written here. Thank you so much. Goodbye.